Welcome to the Steve and Bobby Show. My name is Steve Williams, of course, and I'm here with Bobby Bliatu, the living legend next to me. How you doing, Bobby?
I'm doing good. How are you? You staying healthy?
I'm doing good. I'm staying healthy. We're actually filming in 3 different locations. We got our producer in one location. I've got Bobby in one location. Of course, we got me here at the house because of the coronavirus and all this stuff that's coming up. So let's talk what we were going to get into today. And I want to kind of just discuss some of the stuff and some of the myths that are going on out there. And let's first talk about the number one thing that's out there. Let's put that video up and let's take a look here. This right here, what does that look like to you? What's happening there, Bobby?
I'm seeing everyone says martial law. They're bringing the tanks. And those are tanks, right? Yeah.
Yes.
And it's everywhere, right?
Those are 181s right there. So anyway,
what are we looking at?
I know every time we get into these big things and we see all this stuff that's going on, what's the first thing I see these videos all the time. And being a veteran and serving as long as I have, I promise y'all, this happens all the time. Okay, this is not abnormal. It's nothing different. Oh, look at those are wreckers and HEMTs and all that stuff. Those are actually not tanks, by the way. Those actually fixed tanks. The stuff that you're seeing going through there. Oh well, there's artillery and 113s. And troop carriers and all that. But anyway, this stuff is probably more than likely moving from one location, probably unit training, probably something like that. Could very well be coming back from Iraq. The way they're painted, it could be doing desert training, which means that they're going to the National Training Center out in ETC, out in California, out in the desert there, or they could be coming back from Iraq. These could be being painted because here in the United States, most of our equipment is painted green. So they'll paint it again. They go into these places and paint them green, or they could have already been painted and are being shipped out to some of these locations. So this is not martial law. Don't be scared when you see stuff like this. So
Steve,
just I can explain.
You being someone who thank you for all your service and everything. I know you get that a lot, but I mean your entire family. You guys are a big time military family, and I love all you guys a lot. I want to let our viewers know and people that are out there, those that are kind of watching or thinking conspiracies or thinking martial law is going to happen. What are some key indicators to kind of see? I mean, are we going to see more of these on trains, or are we going to see something else? Like, do they have to stage before they tell us there's martial law?
That's a good point. I mean, there are variables to that. Okay, so if you see vehicles being moved by train like this, trust me, this is very normal. They do this all the time. People probably don't notice this because it doesn't get on their radar until we have stuff that happens like the coronavirus and we're all locked down and all this stuff. So yes, the difference would be if you saw vehicles on trains like this, believe me, it's normal. If you see vehicles on, say for example, on the road, that would tell me that there is not a location, an actual location that train can access to. So if you see them, say, for example, on these big flatbed trucks, right? And you see a number of vehicles that are following military, you do actually see this a lot. Normally when units, say like a 9th Marine unit, which is what they call them bastard units. So units that don't have a headquarters, they'll go and do these offset trainings that are not accessible to rail, right? So when you see these kind of vehicles that are on the road, then that should pop up some radar, because then that means they're being staged outside the rail area. Okay, so now that doesn't mean all the time when you see vehicles on the road or Humvees or that it's pertaining to martial law or something like that. Just simply means that the train can have access to that. So they're using usually mainly like tanks, for example, can't go on roads, right? So usually what they do is they hire flatbed trucks to put them on, and then all the wheeled vehicles will drive behind them, usually the unit. That means that the unit is sticking together, it's cohesive, and it's going somewhere outside that area. So in other words, when we did, I was during the LA riots, prime example of that. We got out of Camp Pendleton, Camp Pendleton has 90-some thousand Marines stationed there.
So, say that again. Say that again so everyone can catch it. You were part of the group that
did the LA riots
during the LA riots. There was martial law
Yes, in the city of Los Angeles, there was martial law. Yes,
And you participated in it. Okay, go ahead.
And I participated in it. So the way they did that, because Camp Pendleton is relatively very close to Los Angeles, they drove those vehicles, all our Humvees, all our Himmets, all our 113s were all driven to the site. And what we did was, as we went, there were certain segments that were stationed in Inglewood. There were certain stations, they would stage vehicles. Once you start seeing vehicles that are staged at checkpoints, or you start seeing vehicles, they start breaking off into certain, like we had, you had vehicles in Inglewood, you had some vehicles in LA and Watts and Compton and Whittier. They broke off all over the place in the city of Los Angeles, because Los Angeles is such a large area of what they call area of contact. So they have to stage these vehicles in different areas. Now, when you start seeing stuff like that, then that's when you need to start worrying about martial law. But if you see vehicles on you see vehicles on trains, it's very, very normal. Yeah.
So don't panic, guys. We're not there yet. Yeah, I mean, I got my own theories. That's a whole nother show of what should happen. But don't panic yet. We're not in there yet.
We're not there yet. I mean, anytime there's a large amount of, I understand that. I get it, especially when you just don't know the way the military operates and you see big amounts of military equipment. It does make it logically, you would think, oh my God, there's something going on here. Trust me, happens all the time. You just probably don't notice it because it's not a big deal on a Wednesday afternoon when you're going and driving to work or whatever. You know what I mean? So I don't know. To me, nothing to be alarmed about. There's nothing that I seen here in the Fresno area where we're located here, Bobby, that I see that would. Now, once you start seeing the National Guard, we have a National Guard here. So, and it's a very nice size National Guard. It's not very small. There's a couple thousand troops here in Fresno that are located right by the airport. So once you start seeing those vehicles all around, then we need to be worrying.
Okay, so one quick thing. I know we got to move on to the next thing, but I do want to ask this. I think it was last Friday, the president called for the Pentagon to get him 1 million names of active duty, retired folks that he get those in medical personnel.
Yes. Well, call to duty. Mm-hmm.
Now, why? Why 1 million?
Because, okay, so here's the thing. This actually always happens as well. So when we went to Afghanistan and Iraq, they did this. Okay, they did what's called, so there's 3 elements. You have ready, active, reserve, right? So you have what's called, anytime anybody enlists in the military, they do 4 years active, 4 years inactive. It's called 4 years active, 4 years inactive. Anytime you sign, so whether you sign for 6 years, 7 years, 4 years, you will always do 8 years of military service. It's the way it's done. Sometimes you only do 6 years of continuous active duty. Now, sometimes when you have shortages, for example, when we went to Iraq, there were huge shortages of combat engineers. What did they do? They activated those engineers. They put those ready reserve guys into active duty status. Okay, that's one. The National Guard. Now, the National Guard, which is at state level, when they start calling into National Guard into active duty, usually that happens all the time. They did it for Katrina. They did it for the hurricane in Puerto Rico, where they activated a lot of the National Guard troops, and that's totally normal as well. When you start seeing an issue is when they start calling on ready or the reserve units. So you have the National Reserve units is usually your last element, and that's what Donald Trump did. He actually called on his reserve units, like his medical staff, anyone that's a doctor, anyone that's a nurse, anyone that served as a medic or combat medic, anyone that served in any type of medical capacity. He actually called them into active duty. And I think he went as far back as 8 to 10 years. So if you served up to 10 years to now, he wants your name. And we have trained thousands and thousands of these medical professionals that are out there that are probably nurses now. Like my wife is a prime example. My wife served as a combat medic, and she was an LVN prior to that. So they could very well call her into active duty through this Ready Reserve program that Donald Trump signed in an executive order to. That's actually really serious, and that's a good point. It's very serious that he called it. In order for that to do that, that means there has to be something very serious happening. and he wants those individuals domestically. So he's promising these individuals will not be serving in an overseas capacity. So not only is that tells you that these individuals are going to be stationed here stateside. So yeah, that could pop up some red flags there, in the sense of they need these ready reserve. Means that something major is happening, but we already know that the COVID-19 is a medical issue, so
right,
it's probably related to that.
That's good. Yeah. Okay.
Yes, sir. So I don't know if you want to move on and we want to start talking about the other big thing about the ibuprofen. I actually found a video of Dr. Hillary Jones. He's kind of like the head of France. He kind of works with France and Britain. He's kind of their head medical health administrator. He kind of talks about the ibuprofen. I know there's a lot of stuff out there about ibuprofen and some of the stuff that's going on there. Is that noise coming out your ear? Through your ears? You hear that? Anyway, I don't know. I want to kind of discuss this, and I kind of want to talk about it in the sense of, remember, when we're talking about medical advice, don't ever take what we say here as word. We're just kind of giving you some of the stuff that's out there. So this is the health administrator. His name is Dr. Hillary Jones, talking about this very thing. Take a look.
About the fact that it's a difficult one, isn't it? There's a lot of confusion over what should I take. A lot of people are stocking up with paracetamol.
Yeah.
Some people are taking ibuprofen. That's absolutely the wrong thing to do.
Yes, and until recently on the NHS website, we were being told paracetamol or ibuprofen. Now, we've got new evidence that suggests that an anti-inflammatory like ibuprofen or any of the family of anti-inflammatories, which would include aspirin, could be worse than taking paracetamol.
Right, so don't do that.
Let me rephrase that. It could be potentially harmful.
Right.
Because you want a bit of inflammation to fight the virus.
Oh.
So by taking an anti-inflammatory, you suppress the protective chemicals released by white blood cells, which fight the virus. So don't take ibuprofen, take paracetamol.
So, Bobby, I don't know if you know anything about this ibuprofen, or, I mean, I know there's all kind of stuff all over the place. Is there anything that you're hearing on your side, since you have these clinics, concerning this ibuprofen? Because I've been hearing all kind of stuff.
Right. So there's a lot of things out there. The kind of thing is, listen to your doctor, do what they say. I do know that early on, when we got our first infection here in America, that Italy had come out with saying don't take ibuprofen. And then in America, they were saying there wasn't enough science to prove that ibuprofen was bad during coronavirus. Today, there isn't enough science right now to say that it's actually bad. But I do know, though, the CDC and our, health department is just saying if they can, take whichever one you need to based on your medical conditions. But if you can, take other things. And he called it a different name, which is like acetaminophen, or what we call Tylenol. And if you can take the Tylenol, then you would be, it's just safer too if you can live with that piece there, right? And that study actually of saying ibuprofen was bad was not about what he was talking about. The fact that it was an anti-inflammatory drug was, I believe the study that actually came out was that it was about the H2 receptors that were increasing when you take ibuprofen, and that could cause the virus to continue latch on and spread in your system. And that was just a theory. And ibuprofen right now, there's science behind it, but it's just a theory still, because it has to deal not with COVID, but more so with like pneumonia and other illnesses that we are studying right now, and the effects of ibuprofen against it. So they're just, better safe than sorry. Take acetaminophen. Should be just as good as a fever reducer, right? And that's why people are taking it. But there are people who are allergic to Tylenol. And in that case, and they're saying, go ahead, ibuprofen should be okay. But the science isn't there.
Yeah. So I guess it would be more than, a lot of these issues, I think, just make sure that you guys contact your doctor, make sure you guys find out what works for you specifically, because what may work for one person may not work for the other. COVID-19 is relatively a new issue here. They're doing all kind of stuff to try to figure this thing out relatively quick. You got the world working on this right now, which is kind of unique. It's one of those things where you have a large amount of countries, especially developed countries. You rarely see developed countries get together all this the way they're doing now. And a lot of those physician brains and those researchers are getting together to try to find this stuff out. So make sure that you're talking to your healthcare provider when it comes to this ibuprofen and all this stuff. So neither me or Bobby are doctors, even though Bobby works with tons of doctors every single day. So, but you're more in the trenches than I am. So, I mean, you would know a lot more than I do.
That's what we're, kind of talking about. There's a lot of things out there that people are saying and living behind, and we are panicking. I mean, we're giving it the respect that the pandemic deserves, but we should not panic and do things that we would not do normally. Right. And we have to be careful, especially our leaders and our politicians and folks that go on shows like that, and even us. We have to be careful in letting people understand that this is, there's studies, but they're not all the way through yet. So go with the professionals. Because we saw the president start to back up hydroxychloroquine and not advertise exactly what those things are, right? Hydroxychloroquine plus azithromycin. He didn't talk about that. And that's a study that's going on in France. And to get that in America, which that treatment is not FDA approved, you have to be part of a clinical trial. So don't self-medicate. There are other drugs that are also being experimented on, running through clinical trials right now, and you can get fast-tracked. If you have COVID-19, you can ask for those things, and then you can go into it. And remember, clinical trial doesn't mean you're not actually taking that medication, because some of these trials give you placebos just to see if it works or not. Truth be told, we have no treatment. Isolation is the only treatment that we have right now. And so just be aware, guys. There's a lot of things floating. And take everything with a grain of salt. Listen to the professionals, and the professionals are the people who are treating you. That's important.
So we're going to move on. We talked about the military issue, or the a lot of things that people are seeing across the country. I see these videos all the time, and then we're talking about ibuprofen. So I kind of want to discuss this is something I think you're pretty locked on in this as well. Is this we have martial law, shelter in place, and lockdown. I have a video. We'll look at the first video. The video will be shelter in place, and kind of what it is I think her name's Dr. or I had her name down, but she's pretty. This is what she does for a living. She kind of talks about the different types of laws that pertain to like martial law and school lockdowns as well. So she talks about like if there's an active shooter in a school, for example, and they got to lock down the school and stuff like that. So she kind of discussed what shelter in place is, and she kind of breaks it down. So take a listen.
Shelter in place means that people who are not considered to be essential workers are expected to stay close to home. The rules for shelter in place are not all that different than the recommendations that CDC has already put out for everybody. Everybody is already advised to maintain social distancing and to try to stay home and not engage in work that's not essential outside the home. People who are under a shelter-in-place order are allowed to leave home to go to the grocery store and to seek medical advice. If you have a shelter-in-place order, generally you'll still be allowed to go outside. You're allowed to take the dog for a walk, you can mow the lawn, you can work in your garden, you can go for a hike, you can jog around the neighborhood, you can take a stroll in the park. The key thing when you're outside is that you continue to maintain physical distance from other people. The recommendation is to make sure that you stay at least 6 feet away from other people who are not members of your household. The essential worker category is a big one, so it includes medical workers, it includes law enforcement officers, but it also includes lots of other people who keep the world running. So people who work at grocery stores, people who are working to keep the electrical supply going, to keep the internet on.
Okay, so she kind of discussed the point of a shelter-in-place order. I know that what we're doing here in the States is a little bit different than what they're doing in Europe. Some places in Europe have some really stringent lockdown policies that are different than what we're doing here in the United States. Well, I feel that are different in the United States. I'm not in Europe. So I have a brother-in-law that actually lives in Germany, and he was telling me that their policy there is pretty strict. So like they can there's fines or certain things that they if they get caught doing, if they're out just for example driving around or something and don't have no reason as to why they're driving around, they're getting fined for it. I heard France is doing the same thing. We have another video on this, but I don't know if you want to bring in something about the shelter in place here in the state of California. I know we were off camera. We were talking a little bit about your idea of the shelter in place. What do you think in essence of shelter in place here, and how strict do you think it is, Gavin?
In all of these things, yeah, in all of these things, we're still looking at mitigation, right? We're trying to keep people away from each other. We're trying to keep this as least contagious as possible. We don't want to spread the disease, and a shelter in place is just allowing us to conduct business that is essential to life, and to stay away from each other to mitigate the spread. We'll see how other countries have taken this, shelter in place further, and it's starting to get the term of actually lockdown. And after we see what they've done, then let's talk about the other things.
So you want to? Yeah, because we do have another video here. We have what I think this is in France. I think this video here that we're about to put up, which is a lockdown within the country, and they give you kind of example of what they're doing there. You guys just saw the shelter in place. Take a listen to what they're doing in France.
France under lockdown, becoming the latest European country to roll out drastic measures to stem the spread of COVID-19. Police patrolling the streets of Paris as new rules took effect Tuesday at noon local time. People here are required to carry a signed declaration justifying why they're out, or else face a fine of up to 135 euros or more than 200 Canadian dollars.
La France vit un moment très difficile.
The French president saying his country is at war with the virus in an address late Monday, explaining that citizens are only allowed to leave their homes to buy food, go to work, seek medical care, or get some exercise on their own for at least 15 days. The move, putting the country's 67 million people under lockdown, is considered an unprecedented act during peacetime.
So I think from what I can see, and I'll have you correct me, of course, Bobby, but from what I'm seeing is it seems as though what France is saying is in order for you to go out your house, you can only go to the grocery store. You can only do, if you're a first responder or you work in those type of environments. It seems the way what they're doing in France is you can only be doing those things, where here in the state of California, it seems to me, and the way I understood Gavin Newsom, which is our governor, saying, make sure that those things are what it's not like it's necessarily you have to do that. But me and you were talking about this. You were saying some cities do have some mayors have a lockdown, right? Which is a little bit different, right?
So this is what's different. That was the whole country, right? Our president has not put our country under shelter-in-place rules. The governor has put a shelter in place. He's put code in, and that we are technically supposed to follow, being left up by the jurisdictions that we have in California. There are some cities, there are some counties that are actually enforcing it, ticketing folks. I know in Sacramento, my employees there, I've been able, they carry a letter and they carry their badge. So that way, if the police pull them over or police talk to them, they can show that they're going to the place of work. They can show that they work there and their employment is there.
Is the letter is that written like, say, management? Would that be you writing these letters?
Yeah,
or
so they have a letter. Yep.
Okay.
Yep. They have a letter from management saying that that our organization is an essential business. They're healthcare workers, and they have the badge to prove that they are there and that we are operating during normal business hours to address this pandemic. And so, like grocery stores and stuff have been giving people letters. I know some people in Fresno have started giving people letters. It's up to your city officials or your county officials to decide if the law enforcement is going to start enforcing it. And I know they do enforce it in some sense. I've heard of people getting citations late at night because you're not supposed to be out, and late at night is kind of when most essential businesses are closed. And so if you are saying, hey, I'm going to a friend's house, that's a citation. You can't be doing that. The presence in France, though, that we saw, they actually have roadblocks. We haven't gotten there yet. Right?
Yeah, we haven't got there.
And I haven't heard of any roadblocks anywhere else, but I have heard of increased police presence in different cities, and they're actually really trying to do the best to enforce that people are only going out when it's essential. Even in France, they're allowed to get exercise because exercise for a lot of folks is essential. And if you live in confined spaces, you can't get it. So they allow you to go outside and do it. If you got to sit down and rest, you can rest, but you can't congregate. You still can't be with folks. I don't know how true it is, but I did see a headline that even in Germany, they outlawed or are citing folks with congregations of more than 2 people. Here we have to say no more than 10. Over there, say no more than 2. Right? So we haven't done it in the whole state. I think there's still 12 states that, the whole country. There are still 12 states that have not done shelter-in-place laws, done any kind of shelter-in-place and allowing folks to do things. And this is very serious.
Florida's paying that price right now. Yeah. Florida's paying that price.
So, right. And whether we call it lockdown or shelter-in-place, we have to do our own community duties by not spreading this disease and staying home. And those of you that are working in essential businesses, please be aware, when you go home, you are possibly able to infect other folks, because remember, you don't have to have any symptoms to have this disease. And so my wife and I, both of us in healthcare, we distance ourselves from our own children.
So I know the way it looks like to me, the way the approach is in Europe, or at least in the French video we saw, the approach is more discipline, almost like disciplining the citizens, where here it seems as though Gavin Newsom, and here in the state of California where I'm at, which is the only thing I can speak of as of now, the approach is more punishing businesses. So non-essential businesses that still stay open are getting fined. I know here, I think it was a $10,000 fine for a couple of stores where they were allowing people into their business or something like that. I've read in the paper. So I know
$10,000 for price gouging. State of California has a law against price gouging during emergencies. So no raising prices, ridiculous prices on food or medical supplies. And that store that got fined $10,000. They have a formula. Every city will be different, I guess, on what is price gouging. It may be for the states. I don't know. Because I just questioned that today. We're trying to buy masks, and I was saying, N95 masks are roughly, I don't know, $14 or $10 for a box of 20, and people are selling masks for $5 for one. And I was saying, oh, isn't that price gouging? And actually, technically, it isn't, because of the tariffs that are happening, of the prices that other people are charging, from China to get over here. That raises the prices, and I'm seeing them as high as $5 a piece when you were paying, 20, 30 cents or so.
So, real quick, I'm trying not to get off, because you brought up the N95 mask, and you're in this business, so you understand. I heard that Donald Trump, I don't know how truthful this is, sent I don't know how many millions of tons of freight of like masks and gal. Is that true? I'm reading this in some of the, like I read a story yesterday on MSNBC that in January, the Trump administration sent, 40 million tons of freight of like N95 masks and
ventilators and stuff like that.
And ventilators. So that is true then. That is true. So why would we do that?
I know as much as you on that one there. I didn't get to see the books, and we only got to see the media report on it and show those pictures. But at that time, I believe our administration thought that we wouldn't be hit as bad, and went to go help the other countries out, and try to be diplomatic in certain ways, not taking serious how we would be hit, right? And we are by far worse than almost any other country in regards to the amount of people. But we are good in a sense as death rate, because we still have the hospital space, and we have amazing frontline staff. We have amazing people in the ER systems, and people who are taking risks. And so we're going to see how damaging this really is in the next couple months. But the point is that we all do our portion, and let's try to listen, and let's be all team players, and not let all these myths get in the way, right?
Yeah, that's I think that's the main thing. So, all right, so let's move on. Let's talk. There is a lot of because of where we're at right now, about the sunlight issue causing or curing or this is something I hear too. I hear it constantly. I hear a lot of people telling me this. This is stuff that when you're on Facebook and you're on Instagram, you're on Twitter, you hear people say this, and I'm like, man, I wonder if that's true. And some of them are very convincing. I hear some of the reasonings behind it. This is so. I want to put a thing on sunlight, and there's this Dr. Khan, who's part of the World Health Initiative. He brings this up. So this is one of these things, one of these myth things that he wants to kind of squash. So we want to take a look at what Dr. Khan says, and then we'll talk about it on the other side real quick.
Will summer kill the coronavirus? Will summer kill COVID-19? Well, I certainly hope so, but that doesn't make anything to be true. The SARS virus actually came about first in November, I believe, and then it went away in July. So that's a couple of strong months in the summer that the SARS virus remained. And the reason it actually died off, what epidemiologists and the WHO definitely has to say about this, is not because of summer, but because of the efforts that they made to control this virus. That's number one. Now, there are, of course, evidences, for example, in Petri dishes or in experiments that these viruses may die off in a temperature of 140 degrees Fahrenheit. That is pretty warm. But that has not been proven to be the case within humans ourselves. So that's why it's thought that maybe the virus may slow down in the summer months. But if you look at Australia, it's summer there in Australia right now, and they do have lots of cases and do have a lot of mortality as well. So the COVID-19 virus will not die off just because of summer. I wish that were so. I wish we would see some act of nature actually helping us out in this situation, but I do not see that happening.
I like how he brought up the fact that it's something I never thought of too. It's kind of funny. He brought up the fact that just because it gets hot in the summer doesn't mean that our bodies are fluctuating in temperature. I never thought of it that way, in that sense. Yeah, that's right. There's a lot of truth to that. I think a lot of the things that people are saying, and this is what I heard about this, is the fact that because of the summer and the heat and the coronavirus can't live, but I mean, we were talking about this in last week that some of this stuff on some of these ships, these coronavirus is 17, 18, some of it, it's 20 days living on the metal of some of the ships. So, I mean, of course, ships are out in the ocean. It's a little cooler. I get all that. But, I mean, 20 days is crazy to me.
So the idea is this, is that, remember, these are all theories. Even what he said is theory. I mean, it could be true that summer comes and it goes away. We don't have enough study on this. He related a study back to our original, to SARS coronavirus, the very first one back in 2003. And the study on that one, and why that was mitigated at the time that it was because we were able to quarantine. We talked about how contagious this disease actually is, the coronavirus too. And so this COVID-19, a lot of people are relating this to the flu because it has flu-like symptoms, and they want to say it's contagious like the flu when it's not. It's much more contagious. But the fact that it lives in water, right? I mean, doesn't live, it's transferred through the water droplets. So when you spit it out or anything like that, it's traveling through your saliva. And so the flu has its season because, as the season warms up, the flu doesn't get to live in different places as long, like on a rail outside or anything that's outside, right? And, meeting people at the park, in the summer when the winter when you're taking kids at the park and people are, spitting everywhere, talking, and it's on the playground, people catch it, it's very contagious there. And that's why, flu is during the winter seasons and it dies off in the heat later on because it's not really transferable outside as much. So you have it taper off. People still get flu in the summer, but just not as much. You relate it to this disease. Right now, we are treating it like it's summer in California and in New York because we are not going outside and congregating in large areas. So the heat's not going to matter because a lot of us have air conditioning units. A lot of us have different things where the water is still going to be there for the virus to live in for as long as it does. So that kind of rate probably will stay the same right now because in the summer, we're all going to be inside. Right now, we're all inside. We're still getting infected at our business places, right? Inside the store, at your grocery store, it's the same temperature it is today as it is in the summer. So the mode of transportation today, I would want to say more than likely are in places that are not warm enough and have enough UV light to actually kill this. And that is the one thing that we look at. If we were going outside and not doing shelter in place, our numbers would be completely different. And then if summer came, then you would see it taper off. But right now we're living like it's summer. And so I'm not going to bank on it disappearing. May have a small taper, but I'm not banking on it. And science and the theories, they're just theories, and we need to mitigate it as best as we can right now.
So, okay, so all right. Well, I mean, I was going to look on the world meter thing here to see where we were at right now, actually. But
where are we right now? I mean, today is Thursday.
Take a look at that because I know yesterday that it was crazy. Yesterday, I saw it yesterday, and I was like, oh, "You have to be kidding me!" So right now, as of today, right now we're at 12:39. We've already lost 638 people. We were at 1,049 yesterday that passed. We're at 215,000 infected, 26,000 new cases today alone. We're at 5,102. Oh, wait, this was yesterday. We're at 22,874 cases as of now, 5,700 deaths. Total recovered is 10,000. So what is that? About 5%, little under 5% actually. And then we have 221,000 active cases with 5,421 critical cases. So
infection rate is what, 230 something thousand?
237,000 as of today. As of today. But it's crazy because the world total is it's almost a little bit over 1 million cases. So basically we're 1/5 of the world's total infected. Now that could be a lot of different reasons. We have we have facilities, we have clinics, we have more places where people, where I'm really shocked at this, and you kind of touched on this with the when we listen to Dr. Khan about the summer initiative, though. If you notice that a lot of these countries by where the equator's at, there's not a lot. I mean, you look at Africa, there's not that many cases in Africa. You look at like Honduras and Ecuador and those kind of places, there's not that many cases there. Now, it could be just simply because there's not that many doctors. I mean, I don't know if that's the case, but I mean, what do you think? That could fall into this heat theory that people keep, attributing some of these viral infections as. What do you think?
Well, you look at Australia, you look at Malaysia, Laos went on lockdown yesterday, Thailand, a lot of places where their weather is just like ours in the summer, and they are starting to increase. So there's no real fact for a lot of these things, and it's all just guessing. And so we can't take action as if it's all just going to get better. We actually have to make sure it gets better now, and we have to do what what we have to do. And like the things that we do know, our death rate is very good compared to a lot of the other countries. And
I mean, compared to Italy and Spain,
right? But you start to look at places like New York, where the death rate is a lot higher there than it is in California. All of these death rates have to deal with the ability for the patient to have the care that they need to survive. It isn't medication, it's the care. Having someone there to have a ventilator for you, to push you through, to have your immune system get going, for you to carry you through and fight through this disease. That's why our rate is low, is because we have the room. If we get those millions of people infected in this country, we will no longer have the space to be able to do it, and our death rates will start to equal those other areas that have the same issues and same problems. And that's why we have to mobilize now, make sure there's enough PPE, because the majority of the people who are getting sick after this, after the hospital beds get full, are the healthcare workers, because there isn't enough protective equipment. Right. And so they're getting sick.
Slaughtered on that. Law enforcement, first responders, EMTs. Yeah, I heard about that.
Firefighters, everybody. So we have to, do our very best to get that curve to have the, lower amounts of new cases every day, and have the room for those people who get sick and need hospitalization, that they can actually go in and survive through this. And we have to carry this on until we get a vaccine or a plan to take care of it, Otherwise, our death rate is going to go up. And that's why we have to do this. We have to make sure that we leave enough space for people who have to be hospitalized. And if we all get sick, then it's, there's going to be problems. And, it's sad to know, a place like Italy last week went to no intubation for anyone over 60. You're over 60, you're on your own. I mean, it was 80, 2 weeks before that, they moved to 60. We can't get there. And so we have to do the very best to make sure that we don't get sick.
All right. So, I mean, these, it's kind of, we kind of talk about the idea of the myth part, but a lot of these things are a lot more deeper than just, saying it's a myth. You know what I mean? There's a lot more, like the ibuprofen. There's a lot of more technicalities to it than just saying, do you take ibuprofen or you don't? It's a lot more complex than that. So I kind of want to change it a little bit. I want to talk about the last. So we went through all of this stuff today. We talked about a lot of the things that about this, this COVID-19. We got into detail about this lockdown and martial law, and then we saw the video of the tanks and stuff like that. So in reference to all that, of course, the federal government, because of where we're at right now and with this COVID-19, put this $2 trillion stimulus package that's together. And I just heard that the feds are doing another $1 trillion. They're doing $1 trillion. They're pumping $1 trillion a day, every single day to the end of the month of this month. I just read that this morning. I don't even know how they're going to do that. It's $30 trillion. But they said it's not taxpayer money. I have no idea how that works. But so the big thing here is the stimulus package worth $250 billion for these checks that are coming out, these $1,200, $500 checks that are coming out. We got into detail about this earlier, pertaining to some of the checks that are coming out to all these. If you didn't see last week's video, please do that. Go to the Mad Dog TV Facebook page and go ahead and watch our last week, because we got into detail about this. We want to talk about the scammer part of it, because I guess there's some issues here pertaining to, I guess scams are starting to come out. There's stuff that's starting to be, people are getting phone calls about, if you want your stimulus check right now, legitimate company. I even got a phone call this morning about it's kind of like an Optima tax relief company called me, said, hey, are you getting your stimulus check? You can always put that towards your, so they're already doing this. This is, even legitimate companies are getting on this bandwagon. So let's put the video. I have a video pertaining to the scammer idea video here. So I want to kind of you guys to look at this, and then we're going to talk about it on the other side. Take a listen.
Scams these days are a dime a dozen, but there's never been a time quite like this with so much money on the move at once. And there are those out there that hope to capitalize at least on some of the initial confusion. The size of this federal stimulus is unprecedented in American history. Billions of dollars in stimulus checks and expanded unemployment benefits.
We have liquidity to put into the American economy to support American workers and American business.
But Treasury Secretary Steven Mnuchin has no interest in enriching con artists and thieves. To that end, the FBI warns that some hope to use the stress and concern over the coronavirus to trick citizens. They'll call or mail you notices saying you must do this or that to get your stimulus check. Make note, the U.S. government will never call or write you asking for money or your personal information. But con artists are banking on you thinking a bit differently about it because of such unique circumstances. Don't fall for it. These calls are bogus 100% of the time.
So, I mean, this happens all the time. It happens towards tax season. It happens when, this junk always just happens. I mean, scammers here in the United States.
When there isn't enough education, when there isn't enough things out there, and this is a moment of panic, and then people want to get these things, a moment of excitement, and there's going to be opportunities to take care of it, right? I mean, to take advantage of it, and the scammers will be out there to do different things, to steal your information. I know down there at the bottom we talked about, it talks about the census, fill out the census, and people actually took advantage of that by going to homes and asking them not only for their names, but then asking them for the social security card, any credit card numbers, whatever it is. And when you present yourself with a little bit of authority, people fall prey to it. And so please don't fall prey to these scams. Getting a phone call and having to give private information, don't do it. Getting a letter in the mail or whatever, talk to some folks, ask folks, because it's very scary. I mean, we have an image here that Steve put up of what a check will look like, and the features that are there. I mean, that's a check that you get for those people who get money back from paying, from tax season or whatever, and you get a check. This is what one will look like. And if it looks any different,
have direct deposit, most people have direct deposit, so it'll go directly to your account.
Set up, right.
Yeah, older. I actually, my mom's a prime example of this. She likes to hold her check. likes to physically go in and cash it. You know what I mean? So she's old school like that. That's just because, you know, that's the era she grew up in. So if your treasury check don't look like that, put that up again, KP. Let's put that check up one more time. If it don't look like that, you ain't getting a legitimate check. Or it's
Right.
got to look like that. I kind of blacked out the numbers on the bottom there, but the check looks just like that. So if you're not getting a check, and even some of them, they kind of look like that, but they can't make them look exactly like that. So
Right.
just make sure
And
that.
so what's a scam that can happen actually? Like, I mean, so you know what it looks like. What can be done? How are people going to scam you? You know, and you know, there are things that you get a check. That's a check you can actually cash. One possible scam is they can make something look like that. Here's your check. You want to deposit it to your account automatically. Please put your name and put your account number here on this thing and send it to us. And you might send it back to them, or you might scan it and fax it to them. And then when they get that, they are able to write checks from your account. I don't know, you know, they can do whatever that they're going to do because they're fishing for that information. Don't fall prey to that.
The IRS will never ask you. They will never ask you for direct deposit over the phone. They don't ask you for stuff like that. They actually ask you for wherever your address is, where you're located. Then they send that information, and they'll send you like a folded, a mail of you putting that information down, and then you can send it in. There's ways you can do now. I guess the IRS is developing a thing now where you can update your information through their IRS website. Don't fall victim to these Fisher sites, because that can happen as well. So make sure that the IRS site that you're on is a legitimate irs.gov site. I think it's irs.gov anyway, isn't it? irs.gov.
I think so.
If it says
I think so.
Yeah, because I use it. You know, I actually use it too. Because when my first wife passed away, my kids got Social Security. You get Social Security for that when a parent passes away. And my kids got it for years, and it used to go directly into there. And I remember we moved and we used a different bank account. We were stationed in Hawaii and we moved. They wouldn't even let me do it over the phone. I actually had to physically go into the IRS and, you know, give them my ID and then give them my avoided check at that time. Now there's other ways they can do it. They can actually do it through your online banking. You can show them, and then they can put the numbers in. But they will never ask you that stuff over the phone. Never. They don't ask you that stuff.
Right.
At least
get an email. Right. And if you get an email or you get some kind of text or something, say, go here. Remember, people can spoof things. So go to it yourself. If they give you a phone number to call, go to the IRS page to call. Or if it's the DMV, go to the DMV page and do it. Don't click on their links, right? Go to it the way that you would know how to from the internet. Get to the official sites and call those numbers, because they can send you an email saying, hey, we're from irs.gov. Click on this one and update your bank account information for deposit. You could do it. You click on that link that says irs.gov, but it might take you somewhere else. You put in your information. Now they have it. So just be careful. And in this time of panic, or this time of anxiety or being anxious to want that check or rush, don't fall prey to these scams. Really, really take time to think about it and listen when you're giving away information that can be used. And trust me, anything more than your name, a lot of times is too much.
Yeah. So, well, I think we covered everything today. I mean, we got down, this is the first time we've ever done something like this in 3 different locations with our producer at one location and Bobby at one location and me at another one. It's the first time we've ever done this. But this is actually kind of fun to do this. I kind of enjoyed it. We'll always be in studios as much as we can, but this COVID-19's got everything messed up right now. So, but we're trying to do what we can do the best way we can do it. Make sure, I don't know if there's anything you want to add, Bobby, here. Is there anything you want to add?
No.
Besides the fact we're tuning into Mad Talk TV studios.
I was waiting for you to say that right there.
So make sure you guys tune into Mad Talk TV. Of course, we're based here in Fresno, California. There's a lot of different shows that we always offer. Me and Bobby always like to promote these shows, from the hip hop scene to the Fighter's Voice to Supermax. What is the Miller Brothers? What is other stuff we have?
We
Ohan,
the hip hop scene. We Money Talks. We got the Sparkle Show.
Right. So we got a lot of different different TV shows and shows that you guys can watch, that you guys can of course stream. Some of this stuff is live and active studio stuff. So some of it is promoted live on Facebook. Some of it is promoted in all different aspects here. Me and Bobby are passionate about there's just stuff that we're passionate politically about. And this is our show. We're the Steve and Bobby Show, of course. But we like what we do. We do it all the time. Bobby gives us a platform to do it. Shout out to our producer that you guys never see, KP, who's behind the.
Tune on Mad Talk, you'll see KP, but KP.
Oh, that's right.
Great job, KP.
Yeah, that's right.
You'll see it. But as you look at the other shows, but KP is wanting me to say right now that we are from one of our financial groups. There's a film festival, and we're going to be airing a new one starting this Friday, every Friday at 7 p.m. There'll be a watch party. Tune into Mad Talk TV shows. You'll be able to see that, and we appreciate all of you guys paying in. Paying attention. Please share these videos. Chime in. Tell us what you want to hear us talk about. What you want to see.
7 to 9, right?
Any kind of other formats. That'd be great, huh?
7. With Richard Martinez is from 7 to 9. A Q&A with director Richard Martinez at 7. Is that on Wednesday? Right, that's on Wednesday, and then can we talk about our upcoming film projects? Can we talk about those or not?
You can talk about what you want.
No, I'm just saying there's some film projects, of course, that's going to be coming out of the Mad Talk TV. Tons of stuff. I know we're working on one about PTSD and soldiers, and we're doing another one. What's the other one we're doing? We're doing one more.
There's several projects out there that we're working on. We're not ready to push them out there just yet.
That's what I was thinking.
For the public. Yeah, I was wondering what you're talking. Yeah, and so we'll wait till the teams finalize everything, and hopefully we got some big projects for everyone to look at in those aspects as well. Always doing our very best to give people opportunity here in the Central Valley, and that's what we're all about. Let's get out there and let's talk. Awesome. Let's put the art and the film out there and do what we can.
And if there's something, and if there's creators out there as well, if there's people out there, look, there are a lot of stuff right here that you guys, because there's big thing right now is creators. So if you guys have some stuff that you guys have content, Mad Talk TV Studios does have a lot of different studios within the where we're located now. Bobby actually moved us from our other location where we were kind of stuffed in there a little bit, but now we've got a lot more space. So if you guys are interested, come and talk to us, talk to KP, or talk to, of course, to Bobby about some of the ideas that you guys may have. Because if you guys have something that Mad Talk would be interested in, maybe you guys can come over here, talk how that can happen, right? I'm sure you guys